Good morning. I'm Caitlin. I'm going to be your NP for the day. Let me just wash my hands.
Okay.
Nice to meet you.
Nice to meet you.
So we're going to be doing a musculoskeletal and a neuro exam today. So we're first going to start. I'm just going to look at your upper extremities. So I'm going to palpate your joints. They have normal color, normal stability, any pain, no tenderness.
Nope.
No pain, no tenderness. I'm going to look at your deep tendon reflexes. So I'm going to start with your triceps. Perfect. Your biceps. And then your brachioradial valves. Perfect, so those are all intact. We're going to look at her strength next. So hold her hands up like this, pull against me, perfect, push against me. So her strength is intact, 5 out of 5. Next, we're going to look at her shoulders. So I'm going to palpate your clavicle, your acromion process, and your head of your humerus. So I don't see any tenderness, swelling, masses, anything like that out of the ordinary there. I'm going to have you lift your arms up for me, go behind, go down, go back. So, and then out, and then in. So abduction, adduction, internal rotation, external rotation, all intact. I'm going to have you hold your arms straight out in front of you and slowly drop them. Perfect. So negative for drop arm test, and that would be if she had like a rotator cuff tear. Next, we're going to look at her elbow. So I'm going to palpate here, see if you notice any redness, tenderness, swelling, the olecranon process, the lateral and medial epicondyle, and ulnar nerve. And I don't feel anything out of the ordinary. No pain or tenderness. Okay, so no pain, no tenderness, no swelling. I'm going to have you go like this. Perfect. Flexion, extension, and then I'm going to do supination, pronation. Perfect. Those are all intact. And next we're going to move on to her wrists and her hands. So I'm going to have you, you can hold your hands like this. Perfect. So I'm going to have you go up and down and in and out. So flexion, extension, ulnar deviation, radial deviation intact. Squeeze my hands for me. Perfect. I'm going to have you hold your hands in a, yep, just like that. So I'm going to check for, this is Fallon's test. So I'm going to push her hands against, and I would do this for 90 seconds, and if she has any numbness or tingling, that would relay that she might have carpal tunnel. So negative, no numbness, no tingling there, correct? No. So negative for Fallon's, and then Tino's, I'm going to tap right here, and if she has any tingling or numbness, that would also say that she has carpal tunnels. Next, we're going to have her, we're going to test her proprioception. So I'm going to have you touch your fingers to your nose, and then I'll have you do it while you close your eyes. So proprioception is intact. I'm going to have you check for kinesthesia, which is where you take your thumb and touch your fingers. Perfect. So kinesthesia is intact. I'm going to have you close your eyes. I'm going to get an object, and I'm going to put it in your hand, and I want you to tell me what the object is, okay? So there you go.
It's a pen.
Perfect. So proprioception is intact. And then I'm going to check for graphesthesia. I'm going to also have you keep your eyes closed. And I'm going to write a number on her hand, or number or an object, but this will be a number, so let me know what number it is.
3.
Perfect. So graphesthesia is also intact. And then the last test, I don't have what we would use to test it, but it would be a circular object, and it would have 2 points on it. And I would ask her to just make sure that she could feel the 2 points on there. So that would probably be intact also. Next, we're going to move on to her lower extremity. So I'm just going to palpate. Is it okay if I touch you? Okay. I'm going to palpate for her, like make sure that the joints are all same color, same temperature. I don't feel any redness, swelling, tenderness, edema, anything like that. I'm going to have you stand up, and I'm going to have her look at you, close her eyes, and hold her hands out like this. And this is going to check for Romberg's. So if she swayed or started to fall, that would be positive, but she has negative Romberg's. I'm going to have her hold her hands up like this, and this will check for pronator, so if her arm was to drift. So obviously she doesn't have any problems, so no negative for pronator. I'm also going to have you sit back down, sorry, and I'm going to palpate and have you push against me for your muscle strength. So push against me, pull against me, push against me, perfect. So her strength is 5 out of 5 for her lower extremities. And I'm going to have you lay back. I'm going to help you lay back. And it's okay if I lift your shirt up? Okay, so I'm going to test for her abdominal reflex. So Perfect. And I can see her her body twitches and I can see it moving. So that's positive for abdominal reflux. Perfect. We're also going to look at her back. So I'll have you stand up and face this way so it's easier for everyone to see. So just looking at her head looks symmetrical with her body. I don't see any bending or like she looks like she has any back problems, but then we'll also palpate and feel. And then I'm going to have you bend forward. Perfect. So her flexion is intact with that. I'm going to feel, I don't like palpate her spine. I don't see any kyphosis or scoliosis. I'm going to have you back up so the extension is intact. Perfect. And then I'm going to have you rotate from side to side. So rotation is also intact. While you're standing, I'm going to look at your hips. So I'm going to palpate for the superior, posterior or anterior superior iliac spine, her posterior superior iliac spine, her greater trochanter, and then her iliac crest. And those are all, they all feel fine. They don't look swollen, redness, edema, anything like that. I'm going to have you stand straight. I'm going to have you lift one leg up. So this is a Trendelenburg's test, and that's negative. So if she was to fall, that would show that. I'm going to have you lay down on our table again, and I'm going to do the straight leg test. So I'm going to lift your leg up, and you just let me know if you have any back pain.
Nope.
Perfect. Other leg. So this is testing for if she would have any like herniated discs, she would have lower back pain. So that was negative for lower back pain. Next, we're going to look at her knees. So I'm going to palpate the femur, the patella, and the knee. So I don't feel any redness, swelling, tenderness. They're bilateral. I'm going to have her, I'm going to check for the ACL tear. So I'm going to have you lay that down. I'm sorry, this is a lot of like switching, but normally it's not as fun. So I'm going to do the drawer test, and what I would do for this is put the patient at 90 and then see if I can feel any tears. So no pain, no tenderness. I would do it the same with the other knee, but for saving time, I won't do that. So that would show me if I felt any movement or clicking, popping, that would show that she had an ACL tear. And then I'm also going to take your foot and roll it down the side. This is testing for coordination. Take it the other one. Perfect, down her shin. So she can do that, and that shows that her coordination is intact. We're going to look at her ankle and feet. So I'm going to have you sit back up. I'm going to look at your, I'm going to palpate your ankle and feet. So I'm palpating for the lateral malleolus, the medial malleolus, the tarsals, and then the metatarsals. So no pain, no tenderness, no swelling. They both seem fine bilateral. I'm going to have you pull against me, push against me. Perfect. And then I'm going to have you go up, go down, go out, go in. So her range of motion is intact. I'm going to also look at your Achilles tendon. So first of all, I'll just look at your reflexes. So her Achilles tendon is intact, and then her patellar reflex. Perfect. So her deep tendon reflexes are intact. I'm going to have you lay on your stomach on our table, and I'm going to test for Achilles tendon tear. So I'll hold up, and so I'll squeeze her calf, and you should be able to see it move just like that. I would do it with both legs. Let's do this one, and that would show that her Achilles tendon does not have a tear. So, and then we're also going to look at her plantar flexion, or reflex, sorry, and so you can see her foot move, and that shows that her plantar reflex is also intact and working. All right, so I'm going to help you back up and help you sit down. So the last part is the cerebellar function. Just tell me your name.
Anna.
Perfect. And do you know what the date is today?
June 18th, 2006.
Perfect. Our president is?
Obama.
All right. Can you tell me what 2 times 2 is?
4.
Okay. So she's been communicating with me the whole time, and she obviously knows where she is. Her ANO, she has ANO times 4. She has appropriate responses. She can answer a math problem. So her neurologic functioning is intact. So that ends our assessment today.